Well, we all know people who have experienced negative side effects of chemotherapy, and some say the treatment is bad or worse than the disease.
Well, now there's a new drug available for patients with small cell lung cancer that can lessen the side effects of chemo. Earlier today, I talked with Dr. Vincent Lamb, an assistant professor of oncology at Johns Hopkins University in Baltimore.
So, many of us have seen loved ones that have struggled with the side effects of chemotherapy, or perhaps have even personally experienced it, themselves. These side effects often include hair loss, significant fatigue, and low blood counts, which can be life-threatening. So we're really excited to have a new drug that can help reduce some of these debilitating side effects, thus making chemotherapy potentially safer and more tolerable for our patients.
Yeah, sometimes people think that treatment is worse than the disease itself.
Yeah, absolutely. As I mentioned, some of these side effects can really be debilitating. One of our dear patients was diagnosed with small cell lung cancer at the age of 28, and she's a non-smoker. And she was just describing about how she went from a completely fit and active regular 28-year-old to a person who really had trouble just even walking up the stairs to our apartment. So it really can impact the quality of life of our patients. So really important to have these new treatments to help our patients through chemotherapy.
So how does the treatment work? It's not in place of chemotherapy, it's to the effects of chemotherapy.
Yes, so for background, chemotherapy actually works by killing the fast-growing cells in our body. So these are the cancer cells that we're actually trying to target. Unfortunately, there can be some collateral damage in that good cells often are impacted, such as the white blood cells that are helping us fight against infection, or red blood cells that help carry oxygen in our blood. So this new treatment is given before chemotherapy is started, and in a way temporarily puts the good cells to sleep, so that they can be protected from the collateral damage.
And this is just for one specific type of cancer?
Well, it's currently FDA approved for small cell lung cancer, but there are several clinical trials ongoing to investigate this approach for other types of cancers, including breast cancer, colon cancer, and bladder cancer. So really a good opportunity for our patients to potentially discuss this option with their doctors to see if it's something that may actually be helpful for their situation, or if there's a clinical trial that would make sense for them.
This could be a game changer in treating cancer.
Yeah, absolutely. I mean, chemotherapy is such a critical part of our treatment for many cancers, including small cell lung cancer. So anything we can do to help our patients successfully go through that treatment is a welcome advance.
For a patient watching this today, what should they say to their doctor? What would you say, I want to try this?
Yeah, so, the drug is called trilaciclib, but there's more information about this at Lung Cancer Foundation that we partner with. It's Lung Cancer Foundation of America, and their website is lcfamerica.org. And that's where there's a tremendous amount of wonderful educational materials that can be very helpful.
Are there other types of research online ongoing?
Well, lung cancer research is happening every day. I often tell my patients that we've made more progress with lung cancer in the past 5 to 7 years than the previous 30 years combined. So on the whole, patients with lung cancer are living longer than we've ever seen, and that's because of research.
But it's still the #1 cancer killer.
You're absolutely correct. It takes more lives than breast, colon, and prostate cancer combined, and really underscores our need to raise awareness for lung cancer. The fact that anybody with lungs can get lung cancer, it's not simply just a smoker's disease, and also to increase funding for lung cancer, because despite it being the #1 killer, it is woefully underfunded. And we've made such progress with lung cancer, and but there's still a lot more that needs to be done.
This new treatment is certainly a giant step forward.
Yes, we're really pleased to have this new tool in our toolbox for our patients.
Dr. Lamb, thanks for being with us today. Great information.
You're welcome. Thanks for having me.
Pretty exciting news.
Yeah, chemotherapy has come a long way, but every little bit helps for people going through it.
Yeah, the side effects can be awful.
Yes.
Well, the country of Colombia is known for